Just a small introduction. Ashok sir has been guiding for the past few years regarding institutes, the right way to choose an institute, right way to approach your plastic surgery residency, and he has been a guide to a huge number of people over the past few years. And I think we in Surgeries are eternally grateful to him. His last counseling also, he was an absolute treasure in helping all these students. So, sir has finished his MCH in plastic surgery from RML, one of the premier institutes, and is working as a plastic and reconstructive surgeon in AIG hospitals, Hyderabad. So, over to you, sir. So, I think sir can start off with a little bit of how to approach NESS, and then he can solve your doubts regarding NEET assist counseling, NEET assist preparation for those who are preparing for the next year, and also the choices, the institutes, and the ranks you are likely to get your institute of choice.
Hi. Hello all. I will actually, it's my pleasure to clear all your doubts regarding preparation and your choice for your institutes. My first and foremost advice for every aspirant for super specialty is first choose your branch. If you're choosing any branch like plastic surgery, CTVS, pediatric surgery, gastro, uro, any branch, that should be according to your passion. It's not like which branch is earning more money, which branch has no more number of patients. It's nothing like that. It's all with your passion because for your whole life you are going to live with that branch only. So first and foremost important thing is choose your branch perfectly, which suits your mindset. So once you choose your branch, once you have decided that this is the branch I'm going to pursue my career for whole lifetime, and prepare 100 give 100% to that branch regarding my preparation, and choose the institute with the good ranks. But this time this is a with the NEET assess pattern. Somehow it is very difficult to choose the institutes, and somehow you might have some confusion regarding the branches. So whatever the doubts you are having regarding choosing any branch or choosing any institutes or anything regarding plastic surgery, what is the future of plastic surgery, what are surgeries we are going to do, how is the growth of plastic surgery in recent times. So whatever the doubts you have, you can clearly ask me. I'm going to guide you. And regarding institutes also same thing, like the main rule for a plastic surgery choosing institute of plastic surgery is there is no best institute for plastic surgery in India. That is 100% you have to keep in your mind. You have to choose with some of the negatives you have to keep in your mind, and choose the institute accordingly as per your rank. Like, there are a number of institutes, like every state will have one or two institutes with around 10 to 15 whole of the whole state have 10 to 15 seats. So once you join the institute, then you can grow yourself with the help of your department, and you can learn the procedures on yourself or with the guidance from all seniors from your institute or other institutes, and handle the patients independently, and you can grow yourself. So don't keep thinking about you should get the best institute only. You should get the you should get the best hands on. There is nothing like that. Uh, so this year with the ranks are around the ranks below 1,000 might get the best topmost institutes, which is equivalent to the last 200 ranks. So within the two, you can compare your ranks with the last 200 ranks, and you can choose your institutes accordingly. And my suggestions while choosing any institute is first choose your branch as per this pattern. Choose your branch precisely. What is your branch? If you are saying plastic surgery, so whatever the rank your rank is, you have to choose plastic surgery only. Second thing, choosing a place. Choosing any place. Choose a place which is most comfortable to you. Like if you are from a place like Mumbai, and if you are getting in a place in a like Hyderabad, so traveling from Mumbai to Hyderabad, it's not a good idea. So first choose your place, choose your state and place. With the bond issues are there now in every state, so better choose a local place, so that you will have that future. You can grow yourself in a local place. Well, unless until if you have top ranks and you are choosing in a premier institute, that is okay. But otherwise, if you are in average to below average ranks, then better to choose in a place which you are going to practice in future. So first choose your branch and choose your place. Then third important point is you have to choose any institute according to your financial capacities. It's not like you are getting a getting a bad institute with a bad pace. So don't that doesn't help you for your growth of your career. So choose an institute which is manages your financial growth also. Because if you're going to an institute and you're suffering financially and you cannot concentrate completely on the plastic surgery also, and you cannot give family and professional life also. And after that, if you have a bond, then you have to go pay for the bond also. So that is going to crush you. So don't choose any institute with the. If you're not able to bear the institute, don't choose the institutes. Then fourth is everywhere there is a confusion regarding whether you have to choose a MCH or DNBSS. So as per like there is absolutely there is no difference between the MCH and DNB. So both are completely equal. So and there are institutes like Ganga which are more premier than institute which are giving a MCH curriculum. So if Ganga institute like Ganga with the DNB is high, like the brand value of Ganga is very huge. So definitely, if you cannot compare like you have to get MCH only, you should not choose DNB. So DNB is 100% equal to the MCS. The only problem with the DNB is like maybe the clearing theory exam, practical exam might be a little difficult. Otherwise, so it is 100% equal to the institutes. So and other thing when you are choosing your institutes is you have to give importance to your family. So because we are all are most of them are married. So any institute when you are choosing, you have to keep consideration of your family. So sacrificing a family and going to a place where you cannot give time to your family, or you cannot giving away from the family is it's not going to help your career. So choose a institute keeping like not 100% you cannot give importance to the family, but you have to keep in mind that whether you are going to manage your family life with the institute or not, so that you can choose the institute accordingly. So these 5 points I'm going to concentrate on choosing any institutes. So first choose your branch, then choose your place, like where you are going to pursue your future career in plastic surgery, and choose according to your financial status, and give importance to your family life. So those who are having 100% clear passion on plastic surgery, so the and you decide that you are 100% going to take plastic surgery branch only, or decided you are branching plastic surgery, then you are free to contact me at any time. So I'm happy to help you with people with passion in plastic surgery. And my observation in last 4 years of plastic surgeries, in 2019 when I joined, the plastic surgery is still on still is on rise only. Like when I'm taken in 2019, there are people who still said something negative to me that plastic surgery is nothing, don't do plastic surgery, better to go for gastro or GI. So, but still I have taken plastic surgery with the passion. Yeah. But in my observation in last 4 years, from 2019 now 2022, this is a fourth batch I'm seeing, fourth batch I'm seeing. The number of people who are having passionate in pure plastic surgery is increasing a lot. So you are, if you are in regarding the scope of plastic surgery. So this is the most common question I am getting from many students, that what is the scope of plastic surgery? So to elaborate in detail, plastic surgery is 8 branches. So as you all know, plastic surgery is like in gastro-surgery related to stomach or gastrointestinal system. Neurosurgery is related to urogenital system. Pediatric surgery related to pediatrics. And in neurosurgery related to neuro mechanisms. So but plastic surgery is not related to any specialty or any age group. You are having a people with the pediatric age group with congenital malformations, to the geriatric age group with RTS or falls injuries, any facelift, neck lift, everything is from the pediatric congenital malformations to the geriatric population. And you are operating not from the head to toe, you are operating from the hair to the toenail. So the scope of plastic surgery is very huge, and you cannot become a general plastic surgeon, because you cannot be operating whole of the plastic surgery. Again, you have to choose a subspecialty in plastic surgery and operate, you improve your skills accordingly. That much huge scope of plastic surgery is there outside. And in last 4 years, the number of plastic surgeons in our country are increasing. The approach of plastic surgeons towards the younger population has increased. Younger students has been increasing, and the patients are getting awareness through the YouTube, Facebook, Instagram. So the aesthetic part of the plastic surgery is improving elaborately, and in oncoplasty with the people who are doing PMMC, DP, that's completely outdated now. Now people are when a patient diagnosed with head and neck cancer, if they are aware of internet, they are just doing Google, and just seeing the patient's pictures with the PMMC and DP, and seeing patient with the chimeric flaps and 3D reconstruction flaps, mandibular reconstruction, dental implants, everything they are seeing in the internet, and they are asking directly that I want plastic surgeon to operate my my oral carcinoma. I want free flap. So people are demanding that. And even in carcinomas like face, BCC, SCC, or anything, the people are asking for the flap reconstruction, not just a primary closures. So the scope of oncoplasty is on huge demand. People are giving opportunities there for the oncoplastic surgeons, and aesthetics is on huge rise with the help of Instagram, TikTok, and everything. People are getting awareness what are the problems in their face and how can they get corrected with the plastic surgery. These two branches are huge rise. And even comes to the burns, the the treatment of burns has completely changed, and it is still changing, and people are getting awareness. Now general surgeons are stopped doing burns, and it is slowly going towards the plastic surgeon. And because we are just not going to treat the burns, we are going to give the best outcome with the burns. We prevent the scar formation, and we prevent the contracture formation. So burns is also on rise. Then congenital malformations, like cleft lip, cleft palate, complicated clefts, and vascular malformation, any hypospadias, any like bladder extrophies, anything, yeah, meningomylosis. Everyone is requires a complicated reconstructions. Then plastic surgeons are available right now, so that is also on rise. And coming to the trauma reconstruction, then previously no one used to do the tendon repairs or nerve repairs. They are just suturing, skin suturing will be done for the hand surgeries or leg wounds. Now with the help of awareness, so people are directly opting for we want plastic surgeon for the reconstruction of their injuries from fingertips, nail injuries to the zone 5 flexor injuries, and any leg injuries, leg trauma, anything, emergency free flaps for the exposed bones, everything they are in trauma. Also the scope of plastic surgery has increased a lot. And coming to the extreme subspecialty like hand surgery, from the fingertip to the brachial plexus, so it is our branch. We have to improve the like scope of hand surgery into the plastic surgery. There may be the orthopedics are doing hand surgery, and maybe the MCH hand surgery curriculum has come up, but still in metro cities, if we can increase the awareness, then hand surgery has a huge scope in plastic surgery. And the another branch is maxillofacial surgery. So that is also in the curriculum of dental. So now it is slowly the complicated maxillofacial reconstructions are coming to the uh, plastic surgery. So in total, plastic surgery total 8 sub branches with like burns, aesthetics, onco reconstruction, trauma reconstruction, pediatric plastic surgery, and maxillofacial surgery. And along with that, there is a one more very passionate specialty like microsurgery. Microsurgery in case of it comes in free flaps, and also in reconstructions, or any like even replantations. So all those comes under microsurgery. Now it is upgraded into super microsurgery, which we are operating less than 0.6 mm of diameter vessels. So, and that is also coming up now. So there is a huge scope, but you have to decide according to your passion. If you have a huge passion in plastic surgery, then definitely the scope of plastic surgery is very huge. And if you are going to involve in self yourself into the career of plastic surgery, definitely after 5-6 years you are going to the best plastic surgeon in your community. So that is the scope of plastic surgeries is very huge. And we, being upcoming plastic surgeons, we have to grow our branch. So I'm going to clear all the doubts which are given as asked in a chat box. So as I said, first and foremost thing I want to clear myself that yeah, I cannot decide which branch you are going to pursue, because the choosing any branch which is 100% suits to your mentality, your mental, your capabilities, your mind status, your future plans, your future setups, and everything. We have to consider yourself and you have to decide your branch. There is nothing like yeah, I am confused between the neurosurgery or plastic surgery, I am confused in oncology, oncosurgery and plastic surgery. There is nothing like that. If you have any doubt regarding any branch, choosing any branch, talk to as many as number of people with the pursuing the same branch. Like if you're in onco and plastic surgery, and you talk to onco people, you talk to plastic surgeons, and you clear all your doubts and you decide one single branch. You cannot choose two branches. You cannot say I am passionate in two branches, because in your lifetime you have to decide only one branch. So it's absolutely wrong things to ask anyone that which branch I have to choose. You have ample opportunities now with the through the Facebook, with the contacts in WhatsApp and everything. You can get number of people with pursuing in the specialties. You can talk to them, you can go and meet them and talk to them. You can ask them what is the future of plastic surgery, or what is the future of that branch, and how the results are there, and how we are going to like take that results into yourself, and how we are going to plan your career in future. So regarding that, you have to choose. Like for my example, I was started with the interest in gastrosurgery. Like every general surgeon has an interest in gastrosurgery. But as my residency going on, I decided that this branch is not going to suit like my character. So I am not going to, I cannot see the patients who are coming with the open abdomen here with a leak in the drains, coming up with, again they are losing the weight. So I cannot see my patients like that. So I decided it may be like biggest branch in MCH, but I decided this is not going to suit to my character. Then I decided, okay, which branch I'm going to pursue. So I gone through all the branches. I talked to many people. Then I attended a few conferences. Then I decided that okay, plastic surgery is something which is really going to suits me. Like in plastic surgery, whatever, if you do cleft lip, you are operated the child, and the child before the operation, after the operation, the result is tremendous, and the results are permanent, and the child is going to have a beautiful life for whole of his age. And even like in trauma, if you're coming with the open wound with a grade 3B fracture and open leg wounds, in emergency, if you are doing a free flap and you're operating on him and you are doing free flap, then 100% child patient is cured. So nothing like patient will come back again with some sinus or anything like. It won't, rarely they will come, but it won't be there in plastic surgery. The plastic surgery, the cure is 100%, and the patient will have the 100% result. So as I heard from my colleagues and everything, there's other branches will add years to the life, but plastic surgery add life to years. So that point has motivated me that okay, I am going to give my patient 100%. So that has like gave huge impact on me, and decided I am going to pursue plastic surgery. So now I am sticking to myself that my whole career, my happiness, everything is the plastic surgery. The same like everyone will have their own character, and you choose your branch accordingly. And the question Shelvika has asked, elaborate a scope of plastic surgery. I think I have already elaborated a scope of plastic surgery. Then types of surgeries and cosmetic surgeries. So types of surgeries I've explained, there are 8 branches, 8 sub branches, each one having wide variety of surgeries. So and cosmetic surgeries, the number of cosmetic surgeries is very huge, starting with the hair transplantation, forehead lift, brow lift, blepharoplasty, rhinoplasty, facelift, lip augmentation, lip reduction, chin genioplasty, then otoplasty. Then coming to the neck lift, and coming down, you are doing breast augmentation, breast reduction, breast implants, gynecomastia. Coming down, you are doing abdominoplasty, you are doing abdominal etching, six pack surgery, and thigh lift, vaginal rejuvenation, thigh lift, calf augmentation. Then you're doing toenail surgeries. So this coming from hair to toenail, you are doing each and every part is yours in plastic surgery. So cosmetic surgery also huge, but never choose plastic surgery for only cosmetic surgery. The cosmetic surgery is just 10% of plastic surgery. But cosmetic surgery isn't huge. But in my knowledge, no institute in no institute in India is giving cosmetic surgery uh, residency. So you have to join plastic surgery. You learn all the general plastic surgery. Then, if you are interested in cosmetics only, then again you have to choose a fellowship or something in outside the country or in our country. Then spend 3 to 4 months on cosmetic surgery and improve your uh, marketing and everything. Then you can definitely do cosmetic surgeries in your place. Then second question is, I have equal interest in both neurosurgery and plastic surgery. So this question is, you have to ask yourself, which branch has less established period? There is no branch has less established period in surgery. In surgery, every branch establishment takes minimum 5 years. You have to invest in your time. You have to work for less amount of salary also, but you have to invest time in yourself. You have to invest in your skills, and you have to invest in your results. Then definitely, even if you are doing any branch, you will excel. There is nothing like this branch has less established period, because every branch has equal amount of competition from other branches. Then if you cannot choose any branch with the less established period. And how high to place Ganga in our list? So Ganga is it's like Makkah for plastic surgery in India. So there is the biggest institute with the high quality plastic surgery they are doing in Ganga. So I cannot place Ganga anywhere in the list. So if you are doubtful about Ganga, then definitely I will give you contacts of Ganga. You can go there. As the consultants, they are very helpful for the future upcoming plastic surgeons. If you have time, you can go there. You can visit the institute. You can see what is the institute, how is the institute is operating, how is the residents working, how are the results and everything. You can talk to them. Everyone is very friendly there. You can go there. You can talk to them, and you can decide accordingly. Then please address if it is difficult to get a job post MCH. I am going to give you 100% clarity on this. It is definitely difficult to get a job with any branch post MCH, because we are not working for the 1 or 2 years of post MCH time. If you are doing MCH, means the next upcoming 30, 40, 50 years, how much time we are going to live, we are going to do that branch. So it is definitely difficult to get a job or something in first 2 to 3 years, but definitely after 2 to 3 years, you are going to excel if you have definite skills. So any branch, you invest in yourself, you invest in your skills and results, and you give commitment to yourself, then definitely you are going to uh, in a big league after 3 to 4 years. Definitely, being in a surgeon after first 1 or 2 years is difficult to everyone, because no one knows your skills, how much you are going to operate, how much you are going to give the results. No one knows. So definitely, they don't directly call you and give you jobs for any branch. Definitely, you have to invest in your time. You have to show up your skills. They have to convince who's the established surgeons. You have to convince with your skills, and there should be need for your skills in your place. Then definitely, you are going to excel in your career. So, what is scope of pure reconstructive surgery? So, pure reconstructive surgery, as I told, with the microsurgery, super microsurgery, and lymphatic nerve reconstructions, onco reconstruction, trauma reconstructions, then the scope is very huge, but you have to be available. You have to promote yourself, and you have to show that you are good reconstruction surgeon. You can give beautiful results. Then the scope is very huge. Like another thing I want to clear here is plastic surgery is upcoming branch, not like neurosurgery, and these are established branches. Every patient knows where to go if they have a problem with the urinary problem. Every patient knows when they have a head injury where they have to go. But no general surgeon knows when to go to plastic surgeon. So if you can promote yourself, if you can promote our branch, definitely every subspecialty of plastic surgery is on rise. So maybe if you are joining 2022, I have seen from 2019 to 2022, maybe from 2022 to 25, definitely it will be on rise. Then next query is, how are the army institutes? So there are two army institutes, I think. One is AFMC Pune, and one is from the RR DNBSS in Delhi. So only the good thing in army institutes is, army institutes are like their work quality is very good. The patient approach, treatment, surgeries, everything is very good. But regarding the bond issues and hospital stay, and regarding the fitness for joining army institutes, these things, if you want, I can give you the context. You can talk to the previous people who has joined in AFMC Pune or DNBSS in RR Institute Delhi. So you can talk to them. You can see, check whether you are physically fit or not. Whether they're going to accept you or not with the fitness. Then only you decide. If you think you are obese, you are unable to fit into the army things, then definitely it's not a good option, because even if you get uh, counseling, they are going to deny you. Something about Sabdajang, RML and KGMU. So RML is my parent institute. Definitely, I'm going to talk good about it. So there is no question about negative things in RML. Sabdajang and KGMU, they are established in 1970s and 80s. So if you ask any person which plastic surgery is best in India, everyone is say Sabdajang and KGMU. So, and either side, every institute has few negatives. So those negatives are going to affect you, or those negatives are okay for you. That thing you have to decide. So if you are in a league of getting this institutes with your rank, so definitely you can contact me. I will give you the contact numbers. You can talk to them personally. If you can go there and visit the institutes, then you can decide accordingly what are the negatives are there in the institutes, and whether the negatives are very very big, whether they are going to affect you your career and your mental status or anything. You can talk to the residents there. If you think this is okay, like these are negatives are there in every institute, then if you're convinced, then there are the Thabdajang and KGMU are the best institutes in India. What surgeries and skills are focused during senior residency to best prepare to solo practice? So solo practice, like I said, in plastic surgery, everything solo practice only. You rarely need a assistant in plastic surgery, but you definitely need a team. Like if you are doing a cleft lip, cleft palate, any hand injuries, wrist cuts, like any small local flaps, transposition flaps, PMMC, DP, you definitely don't need any assistance. You can learn those things. Like you start with the basics, start with the suturing. Like the suturing you have done in general surgery is completely different compared to what you are going to do in plastic surgery. So your suturing techniques will completely different. It will modify in plastic surgery. So first you start with this, learn how to suture a wound precisely, perfectly, and giving respect to the skin. So from there you are still going to learn how to respect the tissue, how to raise a flap, and how to do a local flap, and how to do a like best three layer suturing. And slowly you will learn everything: bond contractures, how to put a graft, how to harvest a graft. Even if you are doing a best skin graft in your general surgery, that is going to change in your MCS residency. So you keep on learning everything step by step, then only you will learn accordingly. Another one is asked, I have been operated for spine for disc prolapse 2 years back. I can operate 3 to 4 hours completely. Can I do plastic surgery? I mean, surgery duration wise. This question I have difficulty in answering. Definitely, the thing is in plastic surgery, if you can see there is Ackland videos in YouTube. This is Dr. Ackland has explained everything in a clear fashion in how to do plastic surgery procedures. So one thing in plastic surgery is everything you are doing, you have to sit. First, you have to comfortably sit, then only operate. If you are standing, comfortably stand, then only operate. Because you cannot bend and operate in plastic surgery. Everything is precise in operating plastic surgery. Your spine should be straight, your hand should be resting on table, your wrist only moving. So there are so many principles in plastic surgery. You have to follow those. So definitely, I cannot exactly answer this if you are going to comfortably operate or not. But compared to other branches, the plastic surgery, most of the surgeries will be done in sitting position only, in the most comfortable positions. So then you can just go and see how I can see in your locality there may be plastic surgeons are there. You can go and talk to them, like how is the situation in their university. Then you can decide accordingly. But in simple wise, we are going to comfortable our place, then only we start operating, because everything is in precision in plastic surgery. People with fine tremors would have problem in future practice. So this is the most common question asked by many residents in learning general group. So fine tremors, you have to decide why they are coming, whether you have any focal problem or is only like something. If you are doing like, if I am first time doing any bigger free flaps, definitely I will also get tremors. So like that, if the tremors are going away once you are becoming familiar with the procedures, then definitely okay. If there is any specific problem, like any neurological problem is there with the faint tremors, then if you can neutralize the tremors with the meditation or something, then that is fine. But if if the tremors are established, you cannot get rid of them, then definitely you're not going to do microsurgery, and you cannot difficulty practice in the precise suturing and plastic surgery. But you have to decide whether the tremors are neurological problem, or is there only any specific, there's non-specific issues, whether you can control them with meditation or not. Then you can decide. Competition plastic surgery in New Delhi in private hospital. This is also a same thing. This question is equal to all the branches. The competition is there in every branch. It's very huge. And if you have the skills, if you have the knowledge, then if you can market yourself, definitely you can take any branch, then you have future. As I told you, if you are doing general surgery, you might need to start your practice from the day one. You can grow and you can establish yourself. But if you are doing MCH in any branch, you invest in yourself in first 5 years, and you slowly grow yourself. Then only you can decide whether how is your growth. Um, my rank is 802. Is there any chance for getting BM Saria? Okay. So as this year is completely different type of like counseling is going on. So the deciding it any institute is a little bit difficult. But you go up the open mind in a first counseling. You just fill the options whichever you like. Then with the first counseling, you will get clear idea how many number of people are clearly passionate in plastic surgery. Then you can decide how many seats are completely excluded in front of your rank. Then how many seats are there behind your rank. Then definitely in second counseling you can expect a better results. But in the first counseling it is difficult to assess. 802 you might have a chance of getting Bangalore Medical College because it has 4 seats. So definitely you have little bit of chance. I cannot say 100%, but you have little bit of chance. At what rank we can get a plastic surgery in government college in Mumbai? So Mumbai has 20 seats in plastic surgery. KEM, JJ, Nair, Sayan, and Tata. So there are 20 seats. So Tata is different. Tata is entirely oncoplasty. It's a prime institutes in India. So definitely it might go early in ranks, but definitely you have the chance of getting Mumbai College up to 700, 600. I expect so. Ganga Institute is the one in Coimbatore. It is Ganga Institute. Everyone can confuse between Ganga and Gangaram. Gangaram is in Delhi, so it won't has DNB plastic surgery in NEET SS. It has DNB SS 6 years course. Ganga Hospital Coimbatore has a DNB SS in 3 years course. It is called as DRNB now. It has 4 seats. It's in Coimbatore. Yes. Which DNB institutes in India equal or better than MCH in terms of hands-on and exposure to advancements? So again, this question, like exposures to advancement is like if you go to Medanta, Indraprastha, Apollo, you can definitely see like higher end procedure, super micro surgery, high level advanced cosmetic surgeries. You can see. If you go to MAMC, then you can definitely see like a government exposure, good hands-on, extremely good hands-on, and like same like government working atmosphere. If you go to Ganga, you can see highly advanced trauma reconstructions. So these 4 institutes are there: Ganga, MAMC, Apollo, and Medanta. MAMC, Apollo, Medanta is very good thing is you'll get a good amount of pay, and you're in a prime city in India. So it has own advantages. Then Ganga, it's a international brand in plastic surgery. So if you're getting a future fellowships in internationals, definitely it is going to help you. So there are so many MCH institutes which are not offering any good plastic surgery. I cannot say the names, but there are institutes which are offering just a basic level plastic surgery. So definitely in terms of those things, these DNB institutes are in a very huge part. This I think don't confuse with sir. Okay. So, I have got rank 64. Have interest in plastic surgery from Tamil Nadu. Is it better to do DNB Ganga Institute or MCH? So this weekend, if you want, you can discuss with me personally. With rank 64, if you are taking plastic surgery, means it's really I am happy for your passion. Then definitely you can talk to me personally. We will discuss and I will help you in choosing the institutes. The Ganga is the best institute definitely. If you are in Tamil Nadu, then go and visit Ganga once. Then decide accordingly. I can give you contacts of Ganga residents. Then you can choose. How is Madras Medical College? Madras Medical College Tanjavur in Tamil Nadu for plastic surgery. So regarding Tamil Nadu, I can openly say plastic surgery is hugely advanced in Tamil Nadu compared to all other institutes in India, all other states. So you take any institutes, any private corporate hospitals. So the amount of plastic surgery, reconstructive surgery, aesthetics they are doing is very huge. So in that way, Madras Medical College has a very good name in plastic surgery. Madurai also they are doing a good quality of work. Tanjavur, if you want, I can provide the numbers to Tanjavur residents. Then you can talk to them. You can decide accordingly. So please drop your WhatsApp number. Okay, definitely, I can give the numbers, but I will be happy to talk with the people who are 100% passionate in plastic surgery only. So I cannot answer questions with which branch is better, which institute is best. Up to what rank plastic surgery is possible in this time? You can get plastic surgery up to 2000, 2005 also, because there are so many institutes which will never be sold in NEET SS. So definitely will get, but I'm expecting the best institute for plastic surgery will be available up to 1000 ranks. Yeah, whatever the thing is, you have to decide after first counseling only. Best colleges I have already explained: the DRNB, MAMC, Indraprastha, Apollo, Medanta, and Ganga. If you are getting both subjudging and RML, which one to choose, sir? This was my own doubt in 2019. I have struggled talking to 50 people, and for my own interest, I chose RML. With the same ranks, people are taking subjudging. With the same ranks, people are taking RML also. But by my own choice, with the confusion of the same question, I choose RML. Kindly give some information about SMS Jaipur. SMS Jaipur is also same like SMS Jaipur, Safdarjung and KGMU. These are the biggest prime institutes in India from last 20 years for plastic surgery. And SMS Jaipur has 8 seats, and they do huge amount of reconstruction, trauma, maxillofacial, all subspecialties they do, and it is a very good institute. The pay is around 70 something. Bond is there. Bond is strict bond is there. If you're talking about the brand value of SMS Jaipur, it's definitely huge, equal and comparable to Safdarjung and KGMU. MAMC, DNB or MCH, BMCRI, which is better? So again, the question you have to choose according to the city. Which city you are going to settle in future? So if you are from Bangalore, if you want to choose BMCRI, definitely it's the best institute. You are getting a MCH from the premier institutes in India. The department is very cool. Work is very good. Quality of work they do. And the problem is pay is little less and fees is little high. Strict bond is there in BMCRA. MMC DNB definitely. MMC is the biggest government institutes in India, but because of some reason they are not getting into MCH. They are getting DNB seats only. So that is why it is considered DNB, but it is definitely 100% equal to MCH. Your degree will be DNB, but your quality of work is same as that of the MCH. Like there's no difference. So MMC DNB and BMCRA again, as I told in first starting, I told you there are 5 components. you have to decide accordingly. For your family issues, financial issues, placement in future, according to that, you have to decide. Both colleges in Andhra and Telangana, basically I am from Telugu states, Andhra, Telangana. There are institutes like Usmania, which has 8 seats. Gandhi has 3 seats. NIMS has 4 seats. Karnool Medical College has 1 seat, I think. Visakhapatnam has 4 seats, and Vijayawada has 1 seat. So all are the topmost government institutes in these 2 states. But amount of hands-on is same as there are many government institutes. Amount of exposure is wide variety exposure is there, but regarding the quality of work they do and hands-on and everything, if you want, I can provide you the context. You can talk to them personally. Kalesh, please elaborate the difference between subducing and RML. Hands-on and exposure is 100% equal in both subducing and RML. There is not even single 0.1% difference between the hands-on, between subducing and RML. Subducing is a huge brand value. RML is very hugely upcoming institute. Subducing has started plastic surgery in 1990 something. RML has started in 2014. From in both are prime institutes in Delhi. Both are central government institutes. Both have equal pay, and work culture is both are same in both institutes. Hands-on and exposure is same. Subducing being a prime institute in India, the number of burn patients referred to subducing are very high. So that is the reason why subducing will have the number of burn patients will be comparatively higher in compared to RML. But that is there for 1 year. Within 1 year, after 1 year, then definitely you will be placed in burns unit, and you will be asked to do the basic burn management and the burn reconstructions. Then after 1 year, then definitely you are going to see all the high level microsurgery, hand trauma, and all other congenital malformation cases. So first year will be little bit tough in dosing, but if you are able to tolerate this tough 1 year period, then subducing it's a huge brand in India. In Hyderabad, which is better with in the NIMS and Usmania. So same, I think I prefer with the NIMS because of the micro reconstruction they do is very high. Usmania also started doing free flaps and all those things. So definitely with the amount of brand value Usmania is having, so Usmania also definitely best institute only. But regarding, so I'm giving you one clarity. Whether the institute is best or not, I cannot 100% give you clear cut my opinion, my independent opinion only. Because if you want, I can give the context. You can talk to them. You can talk to them personally. Then if you have come up with your, if you get some clarity regarding what is the negatives there in the institutes, then if you are going to decide, okay, this negatives I am not going to suffer in my life, then you can definitely remove that option from your list. Then if you are confused between that negatives, then definitely you can talk to me. I can guide you whether these negatives are really problematic, or they can tolerate upon, and they can go ahead. Up to what rank plastic seats will possible to get in Kerala? So Kerala has four. I think there are four institutes: Trivandrum, Calicut, Kochi. So there are I think 4 states, 4 places have seats. Amruta Institute, I'm going to give a one important thing regarding Amruta Institutes. Amruta Institute is the best institute of plastic surgery in India, even though it is like a semi-private and corporate type of hospital, but the hands-on exposure, quality of work they do is very huge. So if you are affordable in paying money to the Amruta Institute of plastic surgery in Kochi, definitely it is the best institute. I cannot compare Amruta with any other government institute in India. So it is definitely the best institute with the quality of work, with the good curriculum, exposure, work-life balance, and everything will be there in Amruta. If you can financially afford it, then definitely it's a good institute. And one more institute is AJ Institute in Bangalore. That is also best AJ Institute in Bangalore. I think that is also best institute for plastic surgery. If you can afford paying money to the seat, then these two are the best institutes. In Kerala, uh, few institutes will go on top, but few institutes will go in a little bit lower ranks. So definitely I can expect you can get Kerala up to 1500 to 1800 ranks. Sir, any institutes which do aesthetics in MCS college? Answer is no, not at all. No institute does in aesthetics, specifically aesthetics. Aesthetics is a very small subspecialty of plastic surgery. So no institute try to do aesthetics in their institutes, and no institute want their residents to practice on patients in MCH residency. So definitely no institute in India will give hands-on for aesthetics in residency, and it is very small subspecialty of plastic surgery, so that no institute practices aesthetics alone. So you will be exposed to basics of aesthetics, but if you are interested only in aesthetics after completion of your MCH with the huge degree in your hand, then definitely you are eligible for fellowships in India or outside India. So please tell preferences. So again, preferences. This is not general surgery you are choosing. You are choosing a branch which you are going to live your lifetime, and you have a crossed more than 30 years of age. So then definitely you have to choose preference according to your financial capabilities and according to your family. Don't choose any institute because of the brand value and for your rank. Always prefer financial capabilities and family life in your options, then only you choose the institutes. Because if you choose an institute where there is zero family life and with the financial constraints, definitely you are not going to concentrate your 3 years on the plastic surgery. So then definitely it will affect your learning purpose. But if you are doing a smaller institutes in your hometown with your family, you are having good time, then you can discuss with your seniors or your other colleagues, or you can discuss with me. There are so many YouTube channels like GK Hand Surgery, Dr. PS Plastic Surgery Education. You can see the videos there. You can discuss with your consultants. You can say that, sir, this flap we will do for this case. Then you can execute the flap. You can learn the skills. So don't choose any institutes if you are not going to stay comfortably in the institutes. So choose any institute preference according to state which you are going to stay in future, and financial capabilities, whether you need a huge amount of uh, uh, stipend, or you can manage with the small amount of stipend with a good brand value of the institute, or whether you can pay the bond money after your MCH, whether you cannot do the bond, you cannot pay the bond money. So considering all those things, then choose the institute, because it is not general surgery. You are not choosing any 3 years of course. This is going to stay for your lifetime. And duration of preparation, if you are preparing for INSCT or next NEET SS or something, for plastic surgery, definitely 3 months of complete 100% preparation is more than enough. 3 months, daily 8 hours is definitely going to help you in a preparation for plastic surgery. But if you are giving dedicated AIMS is a little bit easy to get, because AIMS has started a MCH curriculum in every state in India. So there are more than 20 plus seats in AIMS only. Like AIMS Jodhpur, AIMS Bhubaneswar, AIMS Patna, AIMS Raipur, AIMS Bhopal. So many seats will go empty only in MCH. So definitely you are going to and you are going to uh, uh, get the seat in AIMS. So, but getting a PGI plus surgery is a little bit difficult. Getting JIPMER is also a little bit easy. So how is St. John Hospital, Bangalore? So it is also one of the best institute for plastic surgery in Saint in if you are able to pay the 10 lakhs per year, so then if you are able to spend 30 lakhs, then definitely they are the best institutes, equivalent comparable to all the government hospitals. BJMC Ahmedabad, it is also one of the prime institutes, very huge, hands-on, very wide variety of exposure. Uh, and if you are local to Ahmedabad, then definitely 100% you, if you are getting BJMC, then 100% you take it. And their stipend also increased to around 1 lakh. And the bond is there for, I think, 1 year. So definitely if you are local to the Gujarat, then 100% you can take the BJMC. You will come out as a best plus with good hands-on. So I think I covered all the doubts. Any more queries? Mumbai colleges and order of BGMC Pune of for preference. So if I am in your place, I will keep BGMC Pune in top priority because it is a single seat, single resident institutes with Nikhil Pansal sir is there, Dr. Parag sir is there, and it's a very good institute with a huge amount of hands-on and everything. So definitely your the best institute in BGMC Pune, and then remaining order of colleges. There are 4-5 colleges in Mumbai. I will keep Tata is in a top priority because if you're interested in Onco Plus, then Tata is the best institute. Remaining Sion, KEM, Nair, and JJ, all are equal only. Nair and JJ are keep in topper priorities, then KEM, Sion, and other priorities. Any good colleges in Northeast? I think there is only 2 colleges in Northeast. One is Assam Medical College, and other one is RIMS Imphal. RIMS Imphal, I'm going to prefer RIMS Imphal because it has a 1 lakh salary and it is a no bond institute. So definitely, if you are from a northeast, then definitely go for RIMS Imphal. Ganga Hospital Coimbatore, I think already explained about the Ganga Hospital Coimbatore. Um, Books for prepare for INASS plus surgeries. INASS, I think Suggest is offering one good package for the preparation of plastic surgery, where they have maintained a very high quality material for preparation, because plastic surgery there is no like no one is giving a high proper quality of plastic surgery material or something to the preparation. So if you can talk to surgery test admins and you can choose this thing, or otherwise you can I have collected all my notes and materials, books, and everything. So I can share link with Mr. Vinayak. He will share it to you. Assam and Manipur, I explained. Manipur is the best thing. RIMS, I think. Assam is also good institute. It has now 3 institutes like Assam. Guwahati Medical College is there. Then one more Onco Center has started, and AIMS also started there. So if you are from Assam, then with the growth of plastic surgery in Assam in Oncoplasty, definitely is a good institute. Lokanayak Hospital in Delhi, there is MMC, DNB. I told you already, it is equivalent to MCH. I already explained. Then what about GMC Nagpur? GMC Nagpur, Dr. Professor C. Balakrishnan has originated from the GMC Nagpur only. AIMS HOD is from GMC Nagpur. So it has a very huge brand value with Nagpur. But the amount of work they are doing is little bit gone down due to some other reasons I don't know. But it's clearly a best institute. If you're from Maharashtra, if you're from Nagpur, then definitely it's the best place to work. If you have any queries, then once you can visit the institute and you can talk to the people. I can provide the numbers. MMC Mysore, I think recently only they have started MMC Mysore seat. This is they were doing a good quality of work, but they have started it. So I like any if you are choosing any new institutes, even though they are good, but definitely you have to go there and visit the institutes. You can see how is the curriculum. Like if you are in a new institutes and if you are allowed to, if you are forced to do every night duty, and if you are forced to do all the documentation, basic works, dressings, and everything, then definitely you are going to frustrate. So you can go and talk to the if you are aiming on the specific institutes, you can go and talk to the staff there. You say, "Ki I am from this place. I am specifically interested in plastic surgery. I am going to join your institutes." Then they will welcome you with a very good thing. So you can go and talk to them whether how is the curriculum of the institutes. In Southeastern Railways, I did my DN from Railways. I have very huge craze towards Railways. As much as I heard from Southeastern Railways about DND curriculum, there is one senior professor is there in Southeastern Railways. Madam has improved plastic surgery extremely well in Railways Hospital in Kolkata. So Madam and her husband is onco surgeon. Both are doing extremely great work in plastic surgery. They are doing a huge number of free class and everything. And hands-on is definitely good in SCC Railways. And work culture, everything will be good in Railways only. So if you are aiming at a Southeastern Railways, I can definitely say you can go ahead with the choice. I really like that institute. You can tell the order of colleges which you would suggest. So I already answered this question. Order of college according to your financial. familial preferences, not just for the amount of hands-on, amount of exposure is there, because no institute will give you 100% exposure. Hands-on is definitely depend upon how much you are giving to the department. The amount of hands-on you get it back the same way. Even if you are doing an institute which is less brand value, definitely you are giving your commitment and you are improving yourself. Definitely you can do your cases on your own. Like for example, if you are doing in institutes which they do less amount of work, then definitely you can join the institute. You can go to the surgery department. You can ask them, we are plastic surgeons, we are going to do these procedures, we are going to do fingertip injuries and tendon repairs, diabetic foot reconstructions, oncoplasty, PMMC, DP flaps, or breast reconstruction, LD flaps. Then you can go and talk to the departments. You can say, we are doing these procedures, please refer patients to us. Then you can only start developing the departments. So don't choose any institute just for the brand values. Choose the institute according to your family preferences and financial preferences. This 3 years is not going to make you plastic surgeons. This 3 years is going to give you a degree, which is welcoming to the huge ocean of plastic surgery. KGM Lucknow, as I explained previously, it is a best institute in India. There are few negatives. You can go and talk to the residents here, and every institute has negatives. What are the negatives that are there? How we are going to withstand those negatives? And definitely, if you are getting KGM Lucknow, it's the best institute in India. Sakra World Hospital, Bangalore. I think last year only they started DNBSS. Same like corporate institutes, good amount of work, good quality of work they are doing. If you are okay with the corporate work style, and if you are okay with joining a DNBSS in a corporate institute, then amount of exposure will be very huge. Amount of hands-on you have to decide personally, and you have to talk to the institutes. Then you can decide accordingly. What was KMC Manipal? The same like it is. KMC Manipal is a huge brand value. They also started plastic surgery last 1 or 2 years back only. The amounts, you have to remember, any new institute which has started plastic surgery DNBSS or MCH, corporate institute, definitely you can see that they are doing very huge advanced work. They are doing, this is a clear-cut sign that key plastic surgery is improving. If the KMC Manipal Sakra Hospital has started plastic surgery means their plastic surgery has improved a lot in last 2 to 3 years, and their work has tremendously increased, and they are capable of choosing a plastic surgery residents, and they are doing a good quality work. But amount of hands-on, then you have to do. How is colleges in Kolkata? There are 4 colleges: RGCAR, NRS, Kolkata Medical College, and IPGMER, and also SCC Railways, Kolkata DNBSS. So all are same only. IPGMER is in a topper order because of the 8 seats they are having. They are having a huge brand value. Then NRS, RGCAR, and Kolkata all are almost equal only. There is no much difference between all three institutes. NRS has single seat, so the amount of work, amounts of hands-on, everything will be like on you only. RGCAR and Kolkata Medical has 4 seats. RGCAR has I think 2 seats. SCC Railway is another like DNBSS with 2 seats. Can you tell about BHE Varanasi? If I am saying I have very huge like towards the few institutes. My RML institutes, I like it very much. Then my second preference is BHE Varanasi, and my third preference is AMU Aligarh. These 3 institutes I like because the work is very good there. Department culture is good, and they are doing they are getting a pay of more than 1 lakh, and there is no bond. They are not going to stop you after 3 years. You are free to go anywhere after 3 years, and with the amount of money you can save in your residency, then you can go to fellowships in foreign countries or anywhere. Then you can improve your skills. So these 3 institutes I definitely like, and I like BMC Bangalore also. RML Lucknow, I don't think RML Lucknow has any seat. I'm not sure about it, but I don't think RML Lucknow has plus surgery seat. Maybe this year I might have, but I previously doesn't have it. RML Delhi has, both are the same names: RML Lucknow, RML Delhi. I am from RML Delhi. In Telangana, how is NIMS and Usmania? I think answered this query already. NIMS is in a better preference because of microsurgery. Usmania is in better preference because of the brand value and exposure amount of varieties you see there. Can you tell about CMC, Ludhiana, and Vellore? So Vellore CMC Vellore is very good. Uh, CMC Vellore, Dr. Prema Dandas Madam has developed the department, I think. Then they are doing a very high quality work. But the hand surgery, they have hand surgery MCH also. So hand surgery has a little bit negativity in CMC Vellore. Otherwise, the quality of work is very good. CMC Ludhiana, if you are able to pay the money, I think 7.5 lakhs per year, I think. So if you are from Ludhiana, from the states, from the same state, and if you are able to pay money, then it's the best institute. Hands on in Southeastern Railways is definitely good. All railway hospitals are definitely good hands on. So and the exposure also good, salary also good. But whatever thing is, you have to, if you want, I can provide. Then if you are able, if your rank is near to achievable rank to that institute, then definitely you can talk to the residents there. Then you can decide accordingly. My preference is the best institutes. Whether operate only on general plastics, whether they operate only on general plastic and onco plastic also. Whether they, matlab, I don't understand who are they. Okay. I think I answered all the queries.
Yes, sir. Sir, I think we'll end the meeting now. Sir has answered most queries. What we'll do is, sir, I think a lot of queries are bound to occur as students speak to their friends, students speak to their contacts. So one of the ways is that sir is on the counseling group for plastic surgery. You can post your queries in the group after consolidating all your queries so that sir can answer multiple queries at the same time. So one in the morning, if you post, maybe sir can choose a time when he can answer when he's free at the end of the day or something of that sort. And maybe we can do one more counseling session, a shorter counseling session when the seat matrix is released and we have a little more idea. So this survey which we conducted, I think most of you would have seen the survey. So that would have kind of given you an indication about how many people are going to choose plastic surgery at various institutes. So maybe after the seat matrix is released, 15 days from now on, we can have one more session where you can, clear your doubts after you also consolidate your opinion after talking to us. Thank you so much, sir, for being here with us today. It was a great pleasure. I'm so sorry for spoiling your Sunday evening.
No, it's okay, fine. I will very happy helping this because I got help from my seniors. And definitely, it's very helpful to helping the upcoming plastic surgeons.
Yeah. So I will. A lot of you have texted me regarding the NESS plastic surgery video lectures. So I will post one coupon code on the counseling group as well. A lot of you have kind of asked for me the counseling code, so I'll put it in the public forum so that all of you can use the counseling code. We have made it very affordable. So at 3,500 rupees, you can access the plastic surgery video lectures, and I think that is something which is going to be useful for most of you. So sir, we are also going to shoot a new set of video lectures with sir taking classes, hopefully, where it's going to be useful for first-year plastic surgery residents as well, which could continue to do that. So thank you so much, sir, for being here with us today.